So let's start off with you introducing yourself and kind of what you do day to day and what is Know Your Flaws.
Yeah. So hi everyone. I'm Suzanne. My background is I'm a pelvic health physiotherapist, and I got really passionate about pelvic health after I had my own children, and I saw the massive gap in knowledge. And I'd had some experience as a very young physiotherapist in the area, and I was like, oh, why doesn't everybody know this? So I kind of started getting a little bit more of a specialist role, and then became more and more passionate and realised more and more people just didn't get the right information. And it's quite difficult to do that preventatively, but also within the remits of the NHS. So I do work in the NHS part-time as a clinical specialist now, but I also run Know Your Flaws in the background there, trying to
in your spare time.
in my spare time, trying to prove awareness, getting people talking about pelvic health, making it more accessible so that more people start to talk, start to share stories, because quite often the symptoms are really taboo, aren't they? They're the one thing that, we don't really want to have to open up a discussion about. Or quite commonly what we do here is that if people do start to open up those conversations, they'll either have their symptoms normalized, or they'll often go and see somebody like a doctor who might not necessarily have that specialism. So we sometimes see that people don't get very easy access to the care they need, either because it's normalized or because they get dismissed, or it's just normal after birth. So I'm here to kind of get some of the messages out there alongside loads of other people that are starting to do that, which is great. So yeah, I'm so excited. Thank you so much for inviting me to talk about this area that I'm really passionate about.
No, we're grateful to have you. And as you see, Grace has joined us as well. So Grace, if you do have any questions or want to contribute, please do.
Hi Grace.
Do you guys know each other?
No.
Oh, okay, fine. Grace is she was a Pilates teacher with a special interest in pelvic health as well.
Fab.
Is that fair to say, Grace, in that way? Yes, in that order. So let's start off with the first question. What are the most common postnatal health issues experienced post-birth?
Right, so there's a few, there's loads actually, and I'm trying to think of the ones that aren't spoken about as well as the ones that are. So postnatally, the things that we'll see, you would expect to see are tears that are healing or difficulty healing, which again can cause then some concern. Is it always going to be like this? So the most common thing we will see is people will have some degree of healing to happen postnatally to the skin. And usually they heal really well, because actually we are designed to give birth vaginally, but also if you've had a C-section, again, you've got healing to do around the skin there, and that can all start to affect your pelvic health. So some of the bits that are a little bit less common but do happen fairly regularly are problems with bladder control. So you'll commonly hear some people say they just completely lose control of their bladder in the first day or so, and it can feel quite concerning, because you can go from being totally fine to just like, well, why didn't I know I needed to empty my bladder, and I've just wet myself in front of everyone. So that can happen. You can sometimes find that it's not that severe a reaction. You might just get little leaks or changes where you feel like, oh, maybe I need to go more urgently to the toilet. If you've had a bit more of a complicated tear, some people will find that they struggle to hold wind in. Of course, the first poo is always a bit of a scary one, but some people may find that they either struggle because they become constipated because of either the fear, or they may feel that actually the other way around, they're really urgent and can't control it, and they need to be near a toilet, which can be really disconcerting, especially when you're trying to get out to appointments with a newborn. So there are some of the bladder and bowel symptoms that we might see in the early postnatal days, and they usually, for most people, improve quite quickly. So rest assured, don't panic. But if they're not starting to improve quite quickly, that's when I would suggest people should be reaching out to their health visitors, the midwives or their GPs. And then some of the longer term symptoms that can crop up as you start getting back to more function and you're doing a little bit more are those little bits of leaks or urgency, vaginal changes. So you might notice a feeling of heaviness. So we commonly worry that that's going to be a prolapse. It's not always a prolapse, but yeah, feelings that things are going to drop down, drop out. And then when you're thinking about returning to intimacy, things like feeling dryness or pain with sex can quite often be symptoms that people get if they get a chance to have sex or they're wanting to have sex, because again there's lots of other parts to play with having a newborn, turning to intimacy. So there's some of the common things I would probably see in clinic.
Yeah, and they're quite, I mean, if I was kind of watching this, expecting a baby, I'd be quite worried about those things, I think, and they'd probably cause some anxiety. So what can I do to help prevent that? Have you got any kind of top tips
Yeah.
I'll be thinking about doing in pregnancy?
Yeah, and I think it's one thing why we don't talk about it antenatally is that fear, isn't it, that we're going to scare people into labour. But actually, I think knowing about that these things might happen, people will feel a lot more prepared if it does happen. And some of those horrible symptoms that you get in the early days, they are very, very rare. Sometimes you can't control or prevent them, but just one thing of knowing that they might happen and knowing that you need to seek help is really, really important. For your bladder, for that bit where your bladder might suddenly just give up the ghost and just empty on you, there's a few reasons that can happen. One can be because when you're in labour, you often don't feel your bladder needs to empty because you've got lots of other, signs and symptoms. You're trying to get a baby out. You often don't go to the toilet, and that can sometimes overstretch the bladder. So one really good preventative thing that you can be doing is getting your birthing partner just to keep an eye on the clock. Have you been to the toilet? Just to check that you are perhaps emptying your bladder sometimes during labour. And sometimes it's not that, sometimes it is just the amount of trauma that happens when you give birth, because you're obviously giving birth to a baby. It's going to stretch and move things in terms of nerves, but the most important thing exactly. And just remember that is totally normal. Your body is designed to give birth and to have that stretch. Sometimes it just gives your body a bit of a shock and it goes, oh, hang on, I'm not quite sure what I'm feeling anymore. And then as the person with the bladder, you don't get that sensation. So if you get that, don't panic, but please do raise it and get some support. And there is support for you postnatally. So there are bladder nurses that will, if you need to have a catheter, they will help you with that. And usually within the first 2 or 3 weeks, that is all gone and back to normal. Rarely do you see anybody past that stage, but the early postnatal stage, I remember it very vividly. Time is completely altered, isn't it? You feel like it takes weeks and weeks and weeks, but actually it's only a short period of time, and you think you're going to be like that forever, and actually be reassured it is a short period of time and it should improve quite quickly. Even though if it feels like 3 months that you've been in this position, it'll only be a few weeks. And I think some of the other preventative stuff that you can be doing is thinking about your labour in terms of making sure your pelvic floor can squeeze to support your pelvic organs postnatally. And you get that into your habit antenatally, but also try and get that going quite quickly postnatally. But also in the prep before you give birth, try and think about relaxing your pelvic floor, lengthening, listening to what your body's saying, so that actually when it comes to labour, you're not fighting and holding everything in. And again, that's likely then to prevent you causing problems during the labour by causing greater tears and things like that.
Okay, thank you. And I suppose when you're in that postnatal recovery period, how can you support yourself in that recovery to make it, to encourage it to be a bit, not quicker necessarily, but at the pace your body needs to go?
Yeah, I think be kind to yourself is one of the key bits that often we expect to give birth, and that within 6 weeks you're going to be back to normal. There is a slight narrative still around that of like, oh well, by the time I've got to my 6-week check, everything will be fine. But I always say to a lot of my patients, you've got to think you've had 9 months of growth, you've grown a whole human being. You've then had this moment where you have a lot of change within a short period of time as you deliver your baby, and that is all going to take time. So the key bit is take help, which everybody tells you anyway, but you still feel you want to be independent. So take help, give yourself time to rest, and really key into what your body needs, because we're all so different. Some people heal quickly, some people pick up infections, so it takes a bit longer. So just listen to what your body's saying. And if it's saying, I need to get out and get some fresh air and I can manage a short walk, do that. But if it's actually saying, no, I've had no sleep, I need to rest, rest. And try not to beat yourself up if you're not achieving the same level that somebody else is, because it can you know, it's really the physical and your emotional health are so intertwined that actually we put ourselves under so much pressure to be doing really well. And it does take, you know, our bodies have done an amazing thing. It takes time to recover from that.
Yeah. And often as a doula, I see people like really getting that surge of energy during the day because, you know, the hormones are working to help them look
Yeah.
after their baby. But then you've got to remember it's a 24-hour period. So you need that energy for nighttime as well. So it's like, don't use it all up.
Yeah.
A little outside and nature is great. But yeah, don't overexert yourself.
Yeah, definitely.
Reasons. Charlie's actually asked a question. She's downloaded the NHS Squeezy app, but doesn't it seems like quite a lot of time for the long holds and 3 times a day. Is this really required whilst pregnant?
Yeah, this is a really good question. So the Squeezy app is great. I recommend it to lots of people. But yeah, it's based on evidence where we say we've looked at general population doing exercises. So it's not aimed entirely at pregnant ladies or people who have given birth recently. And it's the one thing I see in clinic is if some people can do, it's like squats. Some people can do 10 squats with no problem, keep going. Some people can only do 1 or 2. And if you've just given birth, you just need to listen to what your body says and work at that level. So initially it might just be a few, and I do the squeeze along, so I'll do a few up, down, and that is enough. Get to a point where you feel tired and that's your workout done. You don't need to aspire to getting 10 straight away. What we aim to get you to around 6 to 8 weeks, depending on obviously where you are at and what other pressures you've got, is that you are able to kind of get to that level and to be aiming to get to that in standing so that you can then move on to running and other activities. But I mean, we say 6 to 8 weeks, but actually for some people that's 3 to 6 months. Other people, you know, it's a little bit sooner than that. So yeah, listen to your body. And if the Squeezy app helps, use that as a tool to remember to do them, but don't feel that you've not done enough if you've not made that 10 squeezes yet. Try to gradually work towards that.
Yeah, it does sound like a lot when you're pregnant, especially with all that extra kind of weight that you're bearing there as well.
It's like severe weightlifting. That's why I always do your pelvic floor with a weight on top, which is better to training than most people do anyway, full stop. So yeah.
Yeah, that's true. Yeah, feel free to try to ask any more if you need to. And so what are the signs that tell us that there are issues? So again, kind of focusing on postnatally, if I had just had a baby and, you know, was sitting around, you actually touched on this a bit earlier as to kind of some of the symptoms. But could you perhaps just maybe elaborate, particularly on the common ones that people would literally be feeling or the sensations they might feel?
Yeah, so commonly it is the bladder leaks, and they can be quite minor. So they might be just as you cough and you sneeze, or they might be, you know, they might be when you've been being sick, or if you've been doing a lot of lifting of your baby, things like that. And so actually most people find that they don't bother you in your general life because you can put a pad on and just get on with it. But that in itself is a sign that you are at risk of future problems. So if you can try and get that sorted early, it will mean that you're less likely to have severe incontinence as you get older. We often think that, I think a lot of people go, well, you just had children, it's quite normal, what do you expect, you're never going to go on a trampoline again. But actually that's completely wrong. You can go back on a trampoline if you want to. So the key bit is don't ignore it, because it won't get better for most people unless they do something about it. And if it does get better, because some people find it does get a little bit better in that immediate postnatal period, it usually comes back with changes in hormones, so around menopause age, or it can come on with future pregnancies, or if you're starting to test yourself by doing more running or doing more activity, or you go to a trampoline park with your toddler. So listen to that. That is your body saying, I'm not quite managing, and start doing your pelvic floor exercises. And if that doesn't improve things, please go and see a pelvic health physio who can kind of give you some guidance. But that is one of the main issues that kind of gets normalized.
And can I just ask, like, what that looks like when you say go and ask for help? Like, what would that physically be? So could you go start with a GP, or would you say just go straight to, if you can?
It really depends on where you're based in the UK and the services that are commissioned. There are lots of services now where you can refer postnatally, so as part of something called the PPHS project that's happened and rolled out nationally. But again, it's been done in segments. So some services have been going for a couple of years and some are just now getting set up. So it's worthwhile. Some GPs will know already, some midwives will already know. So reach out to those people. If you are still struggling to get an answer, there's a group called the POGP. And that, if you Google the POGP, they've got a list of practitioners where you can find information. And so you may well be able to access something through the NHS postnatally, or you should be able to. And if you're not able to, there are private clinicians on the POGP website, as well as NHS clinicians. So there's various bits and pieces. One of the most common difficulties I find for this part of life is that you're juggling so many things. So it's quite often like, okay, I'm leaking a bit, but I can put a pad on. I've got so many other things to deal with. I've got a baby, I've got toddlers, and it's just really difficult to prioritize your pelvic health at that point. So if you're listening to this and you're further down the line and you're thinking, oh, I should have really done this before, there are still options open for you to get some support. But it might be better to go through your GP at that point, just in case you need to go through a urogynecologist, for example. And in the meantime, be doing things like, you can come and follow me on Know Your Flaws, and there's loads of information, free information, so that you can slot it into your life, in and around babies and toddlers and work and everything else that you've got going on.
Yeah, that's really helpful. And yeah, your daily or your squeeze alongs are so good. They just really, they're fun as well. They're not the kind of boring, just really
just pop them in. Get them in if you can. Anything to make it a bit easier, because I'm the same as everyone else. It's hard to get these things in, and they can be a bit boring and dull to do. So yeah.
And can I ask, when you're actually at an appointment, so what would they be doing? What would they be examining? Is that quite a intrusive examination? How does that work?
Yeah, and it puts a lot of people off, so it's a really good question. So if you went to see your GP, they might just give you advice, go off and do it. A pelvic health physio appointment should be, and it will depend on the pelvic health physio you see, but it should be aligned to what you want and what you feel comfortable with. We do intimate examinations if indicated and with consent. So, and it's nowhere near as bad as a smear or anything like that. Actually, we tend to be a lot more, I suppose, well, we're therapists, so we work at a slower pace, and we will only do what you feel comfortable with. So one of our biggest parts of what we will do is educate. So we'll explain before we assess of what we think we need to do based on the questions we've asked you and what symptoms you're getting. For the majority of my patients, I might not even assess the pelvic floor in that first session if they feel really uncomfortable. I'll look at breathing, because there's a whole host of stuff that we do with our pelvic floors and our diaphragms. We can look at scars. I can just look. I don't have to touch. There's a whole host of things. And some pelvic health physiotherapists will use ultrasound as well. So you're not having to do an internal. You can do that on the perineum, so the area between your front and your back passage, to see what's going on. The most invasive part of, I suppose, the assessment would be a vaginal or an anorectal examination, where we'll be looking for scar tissue. We'd be looking to see what the pelvic floor is doing. And it does sound a little bit scary. And I know when I've been in that position myself, I'm like, oh, I don't know if I want anyone to look down there. But actually, the amount of people that I see that come into clinic going, I don't know if I want this, and they walk out feeling empowered because they know what's going on with their pelvic floor. They know what they need to do to make themselves better. So it might feel uncomfortable. Well, it doesn't even feel uncomfortable, because we go very slowly and we don't work in an uncomfortable range. It's not like just having a smear test and using a speculum. We will just use one finger with consent, and sometimes we don't even go very far internally, depends what we're trying to find. But yeah, it sounds scary, but it can give you a huge amount of information that can then enable you to move forward, make improvements, or go and get help from the next layer of support if needs be. So if it's putting you off, I would say, please just go and say, I don't want an internal examination. What can I do? Because we will more than likely help you to the best of our abilities to get you moving forward anyway, whether that's through education, through something else, or just empowering you to go and look yourself and work out what you need to do.
Yeah, I think it must put a lot of people off after childbirth. Because it is, obviously that's just not something you're kind of going to volunteer yourself for very readily. But like you say, it helps so much and prevent so much in the long term as well. Grace says she can vouch for that, and sends most of her clients to get the internal check, and they all say it wasn't as bad as they expected and really worth it. Thanks for that.
Thanks.
Our final question that we've got on here is around sex feeling painful after birth and what could help in that respect.
Yeah, so this is a really good question. Again, there's a few reasons why sex can be painful after pregnancy and labour. One, some people will have pain before they get pregnant. And so if you've had that, again, try and talk about that and whether that has changed postnatally, because again, postnatal bodies are slightly different to antenatal bodies. But if you've had pain before, sometimes that will fuel pain afterwards. So it's important to understand what was causing it before. But postnatally, if you've never had pain before, there's a few reasons. One is hormones. So one thing that we don't talk about very much is the fact that when we breastfeed and when we're pregnant, we have a reduction in estrogen levels. And our estrogen levels are really, really important for our bladder, but also for vaginal health. It helps to keep your tissues nice and plump, but it also helps us provide moisture down there for when we're having intimacy. So a lot of people will find that postnatally, they're like, oh, it's much drier and it's uncomfortable. And that is often driven by a lack of estrogen, compounded by the fact that intimacy changes postnatally because of time. So you tend to have less time to do foreplay and things like that. So you're often like, I've got a few minutes now, baby's asleep, quick, let's have a go. And so, of course, one, your body's not creating quite so much lubrication. Two, you're having to do things a bit quicker. And three, the other main thing is if you've had any trauma during your delivery, whether that be emotional or physical trauma, there quite often becomes a bit of a guarding response that can happen of like, oh, I'm not sure it's going to feel all right or not. And that guarding in itself, which is often from the pelvic floor, or if there's any, anything that's still healing a little bit, can then start a bit of a pain response. And pain is very, very complicated, but your body is basically predicting whether there's going to be damage. So if you start to get pain with intimacy, then actually the next time you have sex, you're like, it's going to probably be painful. So your body will produce pain chemicals to make it uncomfortable. So it can be quite complex. But again, pelvic health physios are really well keyed in quite often to be able to help you to work through some of those. The first part, I would say, if you're struggling with pain with sex, is lubricant. Because if your body's not creating it because you've not got that much estrogen, loads of lubricant, add loads in, and there's some really good ones. So you can go for just a generic water-based one, or you can go for something that I quite often recommend, Yes, and Sutil and Silk, because they tend to be not containing things like glycerin, which can irritate for some people. So there's a few different companies out there that will help with lubrication. There are also silicone-based lubricants. Skin is quite a good one, but again, that tends to be a bit more durable. Or an oil, if you're not using condoms, again, can be more durable. So look at your lubricants and see if that helps things feel more comfortable. If you are struggling with ongoing pain, go to see your GP. They may be able to prescribe you a local estrogen for while you're breastfeeding. And again, that can help to make the tissues feel lubricated, but also less thin and dry. So that can help. And the other thing is, it could be, if you feel like you're getting a blockage, it could be either that pelvic floor guarding, or it could be that it's a prolapse or something like that, something sitting a little bit lower down. Less often it's the second. More often it's a bit of, this isn't comfortable. And so at that point, you may well need either some support from a mental health point of view, in terms of dealing with the trauma, as well as working out how to manage that physically, and looking at whether we need to lengthen out your pelvic floor, work you on relaxing the pelvic floor, or whether we need to get you doing strengthening to lift anything up that might have dropped down slightly because of a prolapse. So don't live with it is the key thing. Please go and see somebody.
Yeah, well, that's an amazing answer. I learned so much. It is one of those things, isn't it, that if you're ready for that, then it can be very frustrating for people, I imagine. So yeah, lots of good knowledge there, and I'll put some links to some lube at the bottom. Thank you so much. We'll tie it up there if that's okay. I'm sure we could talk all day, and unless there's any other questions from Charlie or Grace. And Suzanne, please actually quickly just say about your app that's imminent.
Yes, in progress,
Yeah.
coming soon. So yeah, I'm working on a Know Your Flaws app where you'll be able to ask questions in the app to get some answers to things like this, but also do your pelvic floor exercises in a slightly fun way and learn a little bit more about pelvic health. So coming soon. If you want to have a look or sign up to the waiting list, it's on my website. So find that knowyourflaws.app, sign up, and it should be out between June and September. So I'm very excited. So yeah.
Exciting. You've got a big due time there.
Yeah, I know. I'm giving myself plenty of leeway.
Yes.
Job, it's not like a baby that comes when it's coming, because I wouldn't be ready.
That's great. Thank you. Have a lovely rest of
very
the
much. And apologies again for my delayed start, but thank you very much. Thanks for having me.
No, we'll speak soon. Bye, Grace.
Bye.
Bye.